Hi, myself Dr. Farish. I am a consultant bariatric and laparoscopic surgeon from Cochin. Today our topic is obesity. Will it leads to diabetes and metabolic syndrome? Yes, definitely. Obesity leads to diabetes and metabolic syndrome. Basically, obesity is a concern of increased fat in our body. Increased fat that will leads to the insulin resistance. That insulin resistance is the major concern that will leads to diabetes. So we should know what is metabolic syndrome and what is diabetes and how it's related to obesity. Basically, obesity we divide it into class 1, class 2 and class 3, which we divide according to the body mass index. According to our weight, height, we will calculate the body mass index and we divide the categories into class 1 obesity, class 2 obesity and morbid obesity. So in class 1 obesity, more than 35 BMI and more than 40 BMI as class 2 and more than 45 BMI as class 3 or morbid obesity. So in obesity, the fat which is actually more in our body, that will actually leads to increased resistance for the insulin. So the insulin resistance is basically a reason for the leading cause for diabetes. So there are two types of diabetes, type 1 and type 2. I am talking about type 2 diabetes, which is basically the main life-threatening disease all over the world, and which is definitely obesity is a reason to increase the insulin resistance, and that will lead to diabetes. And metabolic syndrome is another thing. Metabolic syndrome is a syndrome where we can see the people with black color neck or skin fold becoming color changes, and obstructive sleep apnea, snoring, hypertension, cardiac issues. All those things actually combined we used to call as metabolic syndrome. So that is another life-threatening disease. Actually, we consider this as a disease, and you should treat obesity to control metabolic syndrome. Treatment जरूरी है.